You did an ECG. The technician looked serious. The paper came out with zigzag lines. Now you're looking at it like a stock market crash. Don't worry, let me simplify. Hi, I'm Dr. Ashwin Venkatesh, a practicing cardiothoracic surgeon. Today, let me explain what an ECG is, what those zigzag lines mean, and most importantly, what it does tell you and what it does not tell you. ECG stands for electrocardiogram. ECG records the electrical activity of your heart. Your heartbeat works on electricity, yes, and every heartbeat is preceded by an electrical impulse. No electricity, no pumping. Think of it like wiring your house. If the wiring fails, the light flickers. Sometimes it may even go off. Fortunately, your heart doesn't depend on Wi Fi. On ECG, you see repeated waves. Let me simplify it. There are three main waves. First is P, then QRS complex, then T. No need to memorize them. Here's the simple idea. P wave is when the electrical impulse starts. QRS complex is when the heart contracts or the heart beats. And T wave is the time wherein the heart prepares, relaxes and prepares for the next beat. It's like signal, squeeze, rest, and repeat. This, the heart does it 60 to 90 times in a normal adult per minute. If this pattern is normal, good. If it is chaotic, we investigate. An ECG can show a heart attack, any irregular rhythm, heart enlargement, electrolyte imbalance, and conduction blocks. It is quick, painless, and takes only 5 minutes. And no, those stickers are not torture devices, neither are they going to electrocute you. This is where most people get confused. A normal ECG does not mean it's a normal heart. Let me repeat. A person with blockages can also have a normal ECG. ECG is like a snapshot. Heart disease is like the whole movie. Sometimes the problem shows up only during active chest pain or during stress. Silence on ECG does not always mean there's peace inside. Even if your previous ECG was normal, you should seek immediate medical care if you have chest pain with sweating, which is persistent. You have breathlessness on exertion. You have unexplained unusual fatigue, or you have palpitations and dizziness or fainting spells because your heart doesn't follow yesterday's report. I have seen patients come late to the hospital because yesterday's ECG was normal. Please don't ignore persistent symptoms. We treat patients, not just paper reports. Next time you see those zigzag lines, don't panic. ECG is just your electrical signature of the heart. It gives us important clues. It's just one piece of a much bigger puzzle. If you found this helpful, share it with everyone that you care about and all those who worry every time they see the ECG report. This is Heart Decisions with Dr. Ashwin Venkatesh. I help to make heart related topics easy for you so that you can make well informed decisions. Subscribe for more such videos. Thank you.